With me, Congressman Michael Burgess, Republican from Texas, one of the architects of the House bill, and also a doctor. Nice to see you, sir.
Well, thanks for having me on, Greta. I appreciate the invitation.
Okay. So how do you sell this to the American people? Especially, I mean, these decisions are important decisions. They shouldn't be made on politics, but that just sort of reflects how the American people feel about it come midterm. So how do you, with all the number of people who won't have insurance, how do you sell it to them?
Well, first off, of course, CBO's numbers on they do okay when predicting costs and expenditures and taxes. They're less reliable, and this is not a criticism, this is just an observation. They're less reliable about predicting human behavior. They were not that great on the projections on the Part D Medicare expansion that occurred during my first term here. They certainly weren't great on the projections on the Affordable Care Act. Look, they said 20 million people are going to be covered under Obamacare, but there's 10 million people who say I'll pay the penalty or seek a waiver from the mandate. So when I look at those numbers, what I see is that without the individual mandate, if you're not forcing people to buy this crummy insurance, they're not going to buy it. But we have a larger obligation, and look, honestly, we ran in 2010, in 2014, in 2016 on this very issue, getting rid of what the Obama administration had left us with in our health care system. And from a political standpoint, it's almost untenable not to do something.
Okay, but to do something, but as part of the promise, as I recall, is that many of the Republicans said that the Republican plan, which I'm not quite sure there really was a problem, but the Republican plan at the time, is that the insurance would be cheaper and more insured. And I don't get, certainly not more insured out of this. I suppose cheaper if you're getting less, but, sir, I mean, what do we do about those 23 million, and what about those promises?
Well, look, just another observation. This bill is very similar to the reconciliation bill that was passed in December of 2015 by both the House and the Senate. Now, President Obama did veto that bill, and one of the observations after that veto was if the Republicans keep the House and the Senate and win the White House, this reconciliation bill is going to come back. I think that promise was kept. Now, more of the replace elements were added at the early part of this year, and that's what slowed things down a little bit. But honestly, the whole notion that we were just going to leave the prior system that is not working, to leave it intact, that was never an option.
I got that, but the problem is that even if like you have those other promises, the one I think Americans care about is they want access to health care, and they want it at a reasonable price, and if you have a pre-existing, you can still get it. And the problem is that as I see this bill, it's like more people are not going to have access to health care. The prices are going to go up, maybe overpromised. But that's what I worry about. And I worry about the 23 million who won't have insurance.
Sure, and I actually don't think that number is accurate, but and we can argue around that. But the Patient Estate Stability Fund that was added into this bill that gives states a great deal more flexibility. The governors, with 2 roundtables early this year, the governors came to us and said, we've got to have more flexibility in the programs that we're able to design in our states to take care of our people. The governors were, one of their big criticisms was when the Affordable Care Act was done and you're going to reform health care in this country from top to bottom, why were no governors included in that discussion? And that's actually a very valid observation. So we did include them in the discussion, and we tried to be sensitive to the things that they were concerned about. Look, there's no argument from me that this government is too big, and I would like to see things devolve to the states. I think the states can do a better job. We need to listen to what our state partners are telling us, and that's in large measure what this bill does.
Thank you very much for joining us, Congressman, and we'll see how it navigates through the Senate. Thank you, sir.
I'm sure we'll talk again.